Lynette Reddington, Harvey County Health Department Director, and I'm glad to share with the Kansan and the Newton now about what's happening in Harvey County with COVID-19. I can let you know that at this point in time, 183 individuals, and today I should say is the 28th of April, 183 individuals have been tested in Harvey County. We are now at a county rate of 5 tests per 1,000 testing, thank you, Gary, testing rate. And we have had 6 positives. You may have heard that information yesterday. We had another positive in our county. 4 of those individuals have recovered. So I can give you that information. Also, last week, I had just shared with you more updates about the persons under investigation standards that we were provided from the Kansas Department of Health and Environment for testing. And it actually changed by Tuesday afternoon last week. So they are no longer counting a fever as one of the items one of the symptoms, plus 2 other symptoms. The fever has now just been rolled over to symptoms. So if you have 2 symptoms, including a fever as one of those, the criteria has changed for testing with our state lab. That's called Cahill. So just to let you know about that, and that information is available on the state website, which I think I'm going to have Gary share what that is because I don't want to say it wrong. I think I have it in my mind. They just gave us a new website for the public to go to with all kinds of information that also includes how to get to employment information, unemployment information, as well as the COVID data from Kansas Department of Health and Environment. So I'll have Gary share on that. He is our emergency manager for Harvey County. So I just want to let you know a little bit more about our specific cases because some folks ask about transmission. How did these individuals get COVID-19 as positive? And we have had 4 of our individuals receive this from an out-of-county source. We've had 1 from an out-of-state source and 1 that we're just unsure of how the individual contracted the disease. So that's a good rating for us. So 5 out of our 6, we know exactly how they had received the virus. With that, we will talk a little bit about our recovery plan that was presented in front of the county commission, but right now I just want to hand over to Gary. He has some updates for you from emergency management.
I think it's still morning. Good morning. Gary Denny, Harvey County Emergency Management. A briefing on the emergency management realm. The state has created a new website, covid.ks.gov, and it's a centralized site on the state level now for any COVID-19 resources available to all Kansans. So anything that what they're trying to do is consolidate a lot of the efforts into hopefully one-stop shop approach. So covid.ks.gov. On Harvey County level, we continue to address multiple aspects of our event here in the county. I'll share with you that we are still working logistics on an aggressive fashion. And when we talk about logistics, we're talking about supplies, and specifically medical grade supplies. Our responsibility is to monitor the availability and the usage countywide, and if we see a need or anticipate a need to augment that, to support it, to enhance it, then it's our responsibility to look for those resources, what's available, what partners are available for us to meet that need. That continues to be an ongoing challenge, not only in Harvey County, but statewide and nationwide. We continue to address mass care on the county level. We talk about mass care. We've had great partners with the ministerial alliances here in Harvey County that has really taken that task on. Lynette's department, health department, oversees that. However, our ministerial alliances have done a great job in taking that challenge and supervising that challenge. So anybody who has a subsistence need in Harvey County, and that could be food, pharmaceuticals, shelter, infant care supplies, transportation to and from the doctor or to the pharmacy, or even mental health, behavioral health items. If they contact United Way 211, they in turn will route them back to a Harvey County resource and put them in touch with the available resources that are here. Public health and medical services, once again, Lynette heads that particular section up. We continue to work in step with our healthcare providers. If not on a daily basis, multiple times a week, we converse with Newton Medical Center, with Prairie View, the Medical Society, our clinicians, any of the providers, including our EMS departments within the county, and we make sure that we are in lockstep as far as our approach to the issues that this pandemic has handed us. Public safety. The Sheriff's Office is over public safety, and if there are any issues dealing or concerns dealing with compliance to executive orders or compliance to anticipated mass gathering orders or the reopening order, then the Sheriff's Department is collaborating with our local law enforcement departments to make sure that attention is given to that. One of the larger components that we're working with aggressively right now is our long-term recovery section. And Lynette referenced the reopening plan. And that reopening plan is kind of a work in action. It's very, very fluid, and we need to align ourselves with what the governor's new order is going to be. And honestly, we won't know what that new order is going to be until later this week. So what we're trying to move forward with on the county level, and I'll let Lynette speak about the reopening plan, is to make sure that we anticipate, try to stay ahead of some of the challenges that may present themselves later on this week. So there's some challenges in making sure that we stay in alignment with the state on the reopening plan, especially when we are unable to see the reopening plan until later on. And the reason we're addressing a reopening plan, and I think this is statewide, even nationwide, is the stay-at-home order, we understand, cannot stay in place until a vaccine is created. We're being told 12, 18 months out before we have a vaccine. And honestly, we may not totally restore our society and our community until we have a vaccine. But the economic impacts, that's the negative economic impacts, we understand that a stay-at-home order can't stay in place that long. So we need to reopen. And Lynette will talk about the concerns and the precautions that we're going to take in reopening. At the same time, we do need to start looking at what societal restoration looks like, and that's recovery. And along with reopening plan, the recovery plan needs to be a document that is aligned. There's a great amount of lapover between a reopening plan and a recovery plan. And we'll see a lot of the same stakeholders that have input, having input on both plans. So we've really expanded out the partnerships that we have with long-term recovery. We're specifically looking at 5 groups within our community when we talk about reopening as well as recovery. We're looking at an economic recovery redevelopment group. That's headed up by our EDC leadership, our Chambers of Commerce leadership. We stay in communication with them on a regular basis. Number one, we want to keep in tune with what the challenges are in our places of commerce, our places of business, And also, we want that lines of communication, what they can expect with a reopening plan, what they can expect with a recovery plan. We need their input on developing both of those plans. The second group under long-term recovery is health and social services. Obviously, our healthcare partners have a huge role in not only the response, but the mitigation of this. Before we start a reopening plan or a recovery plan, what are the concerns and issues of our healthcare partners? Knowing totally that we may need to reverse directions on a reopening plan. So we want to make sure that we're in unison with our healthcare partners. And we have some great leadership with Newton Medical Center, Harvey County Medical Society, with Prairie View, Department of Aging, the Harvey County Resource Council, all are assisting us in giving us information that we can create these plans. The third group under long-term recovery would be education support and recovery. If you look at any community, they would say that education makes a large portion of a community, what the culture of that community is. So we're working with 3 leaders within our education leadership. Ron Berry, Superintendent of Halstead Schools, Dr. Deb Ham, Superintendent of Newton Schools, and Dr. Joseph Manicam is the CEO, I don't know if that's the proper title or not, but Hessen Community College. And they, in turn, are working with our education representatives across the entire county. And we're asking them, what's some of the items that we need to be concerned with? What are some of the items we need to anticipate? What's going to be our reactions to those items? Our ultimate goal is we want kids back in school. We want back in school as soon as possible. We've embraced the fact that probably will not be until next fall, but we want to be able to be ready for that, if indeed that happens. Government is the fourth group under our long-term recovery. And obviously, the government aspect. We're working with the Council of Government. Specifically, they have identified a task group underneath Council of Government that will once again assist us in looking at that reopening plan, identifying those issues and concerns when we get into recovery. And Rodney Reniger, Mayor of Burton's heading that group up. We have administrator from the city of Sedgwick, Joe Turner, the administrator from the city of Halstead, Ethan Reimer, and Gary Emery, the city administrator for the city of Heston, that's assisted in that group. And the fifth group that makes up our community that we're networking with is our faith-based recovery group, our houses of worship. And specifically, we've reached out to one lady here locally, Rachel Ringenberg, and she's the minister with Shalom Mennonite Church, I believe. And we've tasked Rachel with meeting, conversing with our houses of worship. Once again, what's the issues? What's the concerns if we start to reopen? What's the issues and concerns dealing with our houses of worship? How do we address those items? So as you can see, we have a reopening plan that's being drafted in a rough draft already. We anticipate changes to that draft once we see the state's reopening plan. And at the same time, we're looking at recovery, trying to put together a recovery plan that will guide us, lead us to that societal restoration that we all so want to get back to. But we have to take precautionary measures to get there. Both those plans have a lot of overlap, and both of those plans will continue to be extremely fluid. And the one plan that is time sensitive is obviously the reopening plan. So I'll allow Lynette to speak further on that.
So this morning, the county commission was introduced to a working draft of a document called the Harvey County Health Recovery Plan. Just to, again, remind individuals here in Harvey County that we have taken everyone's health just the most serious here, and we want to make sure that you recognize that some of these phases that we have outlined, though they may change once we do hear from the governor and get orders or not orders from her for moving forward, that this information has all been taking you as a individual here in Harvey County very personally to us in regards to your health and your safety, and we hope that you also consider that when you take your actions here in the community. So we have some gating criteria, and that is just basically criteria that we can't move from a spot until we have all that in place. So, you know, it's like painting a room. You need to make sure you have all your equipment together, you've got everything prepped, and then you can get started with actually opening that paint can and painting. We're kind of looking at the criteria, what needs to be done before we can move to another phase. So the first phase, or excuse me, the gating criteria we have is our long-term care facilities. And I mentioned this at the commission meeting. This is a high priority for us. If you know Harvey County, you know that we have a large number of long-term care facilities, and we want to keep that as one of the highest, again, populations as well to get COVID-19. We want to keep those folks as safe as we can. At this point in time, our facilities are basically in lockdown. They're not having any visitors from outside. We do feel for our long-term care residents greatly because we know they're not getting the interaction that they typically have had, but we do want to keep you safe. So that is our number one, making sure that those facilities have the resources they need. That includes people, materials, information, and facilities. Our local hospital capacity, what can Newton Medical Center handle for critical care or ICU kind of patients when COVID-19 patients come in. So we need to make sure they have the people, materials, information, and facilities, and they're ready to take on this kind of capacity that might be happening if we have a large opening of our current restrictions. Our health department and our investigation capabilities, that is huge as well. We need to be able to investigate these cases very knowledgeable. We need to have our staff up and ready and going, which we are right now. We have 6 cases, we've been good, but we need to get in contact and make sure we're accurate in what we're doing and very timely in our investigations so we can contain the spread. Also, the current testing level, I mentioned we're at 5 tests completed per 1,000 population. That is the minimum the state has put on us right now. I can see the state perhaps changing that, but know that Harvey County has met that threshold, so that is good. And then adequate testing capabilities, having enough testing supplies to meet patient demand. We have had a large number of tests over the past week done here in Harvey County, and we are maintaining that in regards to testing supplies, so we are doing well in that area. Cases, having a manageable number of new cases over our previous 14 days. So again, looking at the capacity we have in the hospital, the capacity we have at the health department for investigating measures that really push on those cases, and of course the spread of COVID-19. And then countywide personal protection equipment, Gary just spoke on that, making sure we have an adequate supply for the current phase of recovery that we are in. We need to keep all those things in mind as we move forward on the plan. So really briefly, I am going to go over it very quickly because I know some of you have heard it already, and we will give more in depth as it gets firmer. And again, it's a working document right now. We're still trying to get all of the pieces together. We don't know how the governor is going to be presenting her piece to us this week. So, you know, things may change, but right now, just to give you a little overview. Phase 1 is called Slow the Spread. We are actually in phase 1. We are at a stay-at-home order from the state. We are at a mass gathering of 10 or less. There are some businesses that are exempt from that mass gathering of 10 or less. So it's really where we are right now. We're familiar with it. We know what businesses can be open. We know how we should be only going out for essential items. That's where we are right now, the slow the spread. It could be that we enter a local stay-at-home order. That is not out of the question in phase 1. Again, we would review the gating criteria, see where we are, and move on to phase 2 if possible. This is the loosening the restrictions. It would be definitely at a 14-day period at a time. It could be extended beyond one phase two. We could have a couple phase two, depending on how things are happening in the county. Again, going back to the criteria. This is where we have 10 mass gatherings, 10 individuals in mass gatherings, but no stay-at-home order. That is off the record on this one, off the book. Long-term care facilities would still remain closed to visitors. Again, very vulnerable population. Restaurants would be allowed to have some dine-in, and they would be restricted under our county plan to only have 10 customers in for dine-in. And there would still remain no self-serve in any of our restaurants or other areas where self-serve is usually seen. As we look at those gating criteria again, check the spread, see how many cases we have. We'd possibly be able to move to phase 3, which is called lift most restrictions. We would be at 28 days at a time. That gives us time as public health to be able to watch if there is more cases and how that spread is happening, and are we getting clusters, things of that nature. So it's a 28 days at a time. And this would be mass gatherings of 50 or less would be mass gatherings. Not a lot of changes at this point other than what we mentioned previously. We'd still be able to dine in, be able to have more, encourage social distancing. The whole plan encourages social distancing, 6 feet from people, 10 minutes or less. And it would also, the whole plan encourages recommended use of masks, particularly for employers who have employees who are in with the public often. So phase 4 is called returning to a new normal. That is set also for a 28-day period. And there are no mass gathering restrictions. They have been removed at that point. Again, we are going to track very carefully our cases. We are going to watch for community spread. We are going to be on top of that and keep everyone informed. And if we need to, we will move back to one of our other phases, but one at a time. We would go back to phase 3. We would go back to phase 2. We would not jump phases. We would go back to the previous phase. And then we have phase 5. Phase 5 is, we're calling it normal, but it is actually when we have a treatment or a vaccine. So that will be a ways off. As Gary had said, it could be up to 18 months or more that we are waiting because trials need to be done. We want to be safe. We want to ensure the vaccine works. So phase 5 is a ways off the normal. So just wanted to give a little brief nutshell of that. And as this gets firmed up, I'm sure I will be back in front of you to share more about specifics so that everybody in Harvey County can be educated and know what's happening. So right now we're doing the best we can with the information, the evidence, the data that we have. And as we have continued to say, it's a very fluid process and a very fluid disease in regards to how we are able to react to it, keep people safe. Again, washing your hands is the best. You can do that. Social distance when you're out. And recommend to wear a mask. So, we'll take any questions.
Okay.
That was a long one today.
Yeah. So you kind of laid out briefly some of the gating criteria, and I have a chance to read the plan a little bit. Outside of that May 4th date the plan outlines, do we meet the gating criteria currently to move to phase 2?
I will say that we have looked at this gating criteria very strongly, and the commission is the one that will make the decision in regards to moving from phase 1 to phase 2. Right now, we are not a county that has a stay-at-home order in place. So if you look through these criteria right this moment, we're doing well. Let me put it that. We're doing well that we could move right into the phase 2. But we have a large influx of cases as we go to phase 2, and we just have a big case. We'll need to move it back, and we'll be back to a stay-at-home order with the minimum of 10 or less for mass gatherings.
Okay. And you talked about, working to kind of gather data, and some of the gating criteria is does the hospital have the capacity to handle the people we have who are ill? Do you guys have an idea of what that capacity is currently?
Sure, the hospital keeps us up to date on what's happening over there. They've obviously had some COVID-19 clients, and they have shared with us that they have a wing set aside. I believe we've talked about this before, for setting up for ICU conditions for patients with COVID-19. So at this point in time, their capacity is good. They can handle things at this
What
point.
is that capacity number-wise?
I'm not gonna get into numbers because that would be something I'd ask you to ask to Newton Med Center.
Okay. And how about case tracing? Because we've only had 5 or 6 cases, and I
Yes.
know I figure you guys have been doing a ton of work tracing cases. What kind of capacity do you estimate the health department having to trace cases? Because I'm sure we're going to hit a number. If we do hit a number, it gets pretty dang hard for you guys to. There's only a few of you there, right?
In our Harvey County Health
Yeah.
Department, yes, we have 4 staff on it. If we need to put all of us onto tracking cases or contacts at this point in time. We have other resources we can reach out to from Kansas Department of Health and Environment to assist us, as they always have in our epidemiology investigations, because some of our other diseases that we need to investigate are much more intense than what we need to do for COVID-19. And so they've always been a backup for us. Recognizing they have a lot of clusters in the state, and they're also helping those areas, particularly right now. And then they have also set up some more resources for us that we can request from CDHE. So I don't have a number to say if one individual had 200 contacts versus we have 10 cases and each of them have 10 contacts. It's really going to depend on the type of contacts that the individual had. And obviously the frontline contacts, I would say your family members, those are usually our first contacts that we make, or any kind of family members who have had direct contact with the individual. And then we go from there. There's a couple different criteria that we have to keep track of.
I know last week there was kind of a kerfluffle over the Saturday night cruise, or I should say 2 weeks ago. Was last week any better, do you think, or?
We're asking about the Saturday night cruise last week, which I understand we were celebrating in Newton, the 8th graders who are graduating. I also was told if I didn't hear anything, that was a good thing, and I didn't hear anything. So I'm gonna say probably because they don't have as much freedom of driving as perhaps our seniors in high school. We did not hear of any kind of gatherings of them per se, and I didn't hear from the police saying we had a huge group of folks gathering and getting out of vehicles, so I hope they took heed of what I had said the week prior. But yes, I didn't hear of anything. Maybe I'll get calls when I get back to the office. Thanks, Mark.
I think it's important to highlight all the work you guys do, just so the public has an idea of how much time does tracing one of these cases take, like going through all the contacts, calling all the contacts, informing people.
Yeah, it does depend on how many contacts an individual has had, obviously. If it's somebody who just stays around home and has been because of the stay-at-home order and just happened to go out and got in contact with someone because they needed something at a store, it may be that they only have about 6 or 7 contacts. If it's an individual who perhaps works at one of our stores, we may have to put out a mass notification that says, if you are at the store between this day and these times and these times, please contact the health department. Obviously, those kind of cases take a lot more time for us to investigate because we have that. So I really can't put a number of hours on one particular case. We do have constant monitoring of an individual who is a positive. They report into us their temperature, their contacts, depending on, again, the level of the contact it was with that individual, will report to us daily on a temperature, sometimes two a day, depending on what the severity is, particularly for the patient or the case. So it's a number of hours, and we have never really kept track of how many hours.
Okay.
Lynette?
Yes, sir.
You asked about the contact tracing. Our local resources have not been overwhelmed to this point. And identifying that contact tracing is a need across the state, testing is a need across the state. The state is training, they've asked for 400 volunteers specifically to be trained to assist counties in contact tracing. As that continues to get ramped up, I believe our local health department will have those resources from KDHE to tap into at some point, if indeed we're challenged with keeping up with the number of contact traces that they need to do.
Okay, thank you. That's helpful. I understand you have been working with the Harvey County Medical Society to kind of work and formulate these plans. Do you know, are they recommending an easing of restrictions by May 4th?
I'll allow Gary to talk on that. He met with that group.
That is one of the groups that within our health and medical group, recovery group, that we've tapped into not only for information concerning a reopening plan and a recovery plan, and they were gracious enough to give us a lot of recommendations on the reopening plan. And once again, it's kind of time sensitive to get all this information so we could continue the process with putting together our draft to get in front of the commission. But the recommendations from the Medical Society are contained. All of those recommendations are contained in some aspect in the reopening plan.
Well, I understand that you have the recommendations. Are they recommending that we open on May 4th?
Their recommendation is they totally understand that the stay-at-home order cannot continue. And they know that the community probably would not tolerate it. So their recommendation is that they believe most communities are willing to accept some of the risks that go with reopening. But along with those risks, we need to identify the benefits and we need to identify the precautionary measures that we enter into those with. So along with those, they've recommended several of the items that we've included in our reopening plan. Specifically, one of their larger concerns with the long-term care facilities. They've given us recommendations on how do they reopen. Obviously, they can't reopen simultaneously to a restaurant. So there's going to be a lot of, I don't want to call them discrepancies, but scaled reopening. And probably the industry within our community that will be the most scaled to reopen is going to be our long-term care communities.
Okay. And since you're up there, we've had a lot of discussion about supplies and test availability. Are you guys, on the emergency management side, are you guys getting the protective supplies you need from the state of Kansas? Are we doing okay right now on that?
We continue to have a challenge when it comes to acquiring personal protective equipment. And we talk about supplies, we're going to just concentrate on medical grade personal protective equipment. At the moment, and I say at the moment, our inventory and our usage we're monitoring and we're sustaining. However, the things that we need to anticipate in any kind of a plan is those challenges in the future. If we do have a spike, if we do have a cluster, if we do have a positive case in a long-term care facility, we can see the usage of these things drastically increasing. And we continue to identify where we are weak and we try to shore those weaknesses up the best we possibly can in anticipation. But our community can rest assured that on today's usage, on today's availability, we're sustaining at an adequate level.
Has there been any discussion from the state of Kansas, because I know that they're opening up some of these like widespread community testing sites or drive-through testing sites. Miami County that has a similar number of cases, is trying to open one of those up. Has there any been talk with the state or any kind of push with the state to get those resources here?
Lynette, testing is your lane.
At this point in time, we have not been speaking with the state about getting a drive-through type testing unit. We have been keeping up with our tests. At this point in time, we had, let me grab my notebook really quick. Yeah, was it 44? We had, yeah, I think it was 44. That's why I'm checking really quick. We had 44 tests done over last week, so that was just last week's. That was an increase from the week prior where it was just 17 tests. So in Harvey County, we're getting the supplies for testing right now. We are doing the testing from our providers. So at this point, we're doing well. And again, individuals have to have symptoms. All those drive-throughs you hear about, people have to have at least 2 symptoms of COVID-19. So it's not just open for you and me to just go in line unless we have symptoms. So
Is there any
know that.
Oh, sorry, I didn't mean to cut you
No,
off.
it's okay.
Is there any indication on when people will be able to just go get tested if they have, say, one symptom? Or is the state giving any kind of plan or direction on that?
Yeah, I do not have any direction on that at this point in time. We have not heard any changes.
Yeah.
But again, it changed last Tuesday afternoon on us,
Yeah,
so.
fair enough.
I know during the county meeting, they kept saying that any recovery plan we have can't go below any state mandate, but it can go above.
Correct, it can be
Any-
more restrict.
Is there any situation where you see the county going above anything the state does?
Again, if we look at our gating criteria and we feel that there are stronger reasons because we have a large influx of cases and the state has said you can have gatherings of 50 and we say, hey, we need to go back to our phase 2 where we have 10 gatherings of 10 or less, that would be a situation because we looked at our gating criteria that we had for Harvey County. So that would be where we get more strict than the state. And we're allowed to be stricter, but again, not looser than what the state has for criteria. Criteria for the orders.
And I don't know who this goes to, but last week it was an interesting story that I thought it was an interesting story, speaking with Ardent Mills. Just the amount of flour that they're pushing out, and like the huge need, especially tied to, looks at how our food industries do work with all the stuff going on in Dodge and Finney County. Are we looking at that or doing anything to kind of ensure some of these important industries are, I guess, staying safe? Because I mean, I could see that being a large statewide or national issue.
Absolutely. Ardent Mills has been identified as a critical component of our food processing infrastructure nationwide. People would be amazed at the amount of packaged flour that comes out of Newton from Ardent Mills. And once again, our recovery section, we specifically have that economic recovery and redevelopment who maintain that direct line of communications with our places of commerce, Ardent Mills being one of those. And any of the notifications from KDHE or our local health department or through CDC, we route through our economic recovery and development group, and they in turn put that out. So Ardent Mills has been included, will continue to be included in the loop, the communications, and making sure that we keep them apprised of opportunities and information as well.
Do you think the state of Kansas understands how key a component something like Ardent Mills is? Have we communicated that to Kansas?
I think they do. I think right now they're challenged with meat production. Southwest Kansas, it's been put out there that 25% of the packaged meat that comes for the nation comes out of Southwest Kansas, and the challenges that we're having with those meat packing plants at the same point. So that highlights the intricacy of the food supply chains, the fragility, if you want to call it that, going back to the Christmas story or whatever. It identifies how fragile our food chain suppliers could be. So that's why we continue to try to identify those, embrace those, so we can protect them as much as we possibly can.
I just hope the state would understand that when they're distributing resources.
Yeah.
Do you have other questions, Mark?
Well, we appreciate your time this week, and again, everyone stay safe, stay healthy, stay home just at least a couple more days. We'll see where it goes from there. Thanks a lot, and we'll talk to you again later.